So the coronavirus seems to be a novel virus that's come from an animal reservoir. It's emerged from an animal reservoir in Wuhan city. It's a virus that causes respiratory symptoms, so it can cause symptoms similar to a cold and flu, but in its serious manifestations it can cause pneumonia, and it can even cause death. Well, we're not sure at the moment whether this particular virus is more infectious than, say, the SARS coronavirus. Obviously, what we have seen over the past few days is a marked increase in the number of cases, and there can be various reasons for that. For example, the virus might have been circulated for longer than we thought, and therefore seeded far more infections in the early stages, and then that's given us the larger numbers that we see today. Or it could actually be more efficient at spreading between people, and so it's difficult to say, and that's one of the important questions that needs to be answered. I think in terms of the Western world, so developed countries like the United Kingdom, places in Europe, America, Australia, places like that, with good surveillance systems, good health infrastructures, they are well set up to deal with what is likely to be sporadic introductions of the novel coronavirus when they see them. I think the much more serious and wider threat, and certainly mid to long-term threat, is if the virus gets introduced into countries that don't have the same surveillance and healthcare systems in place. Places like, for example, sub-Saharan Africa, which is well connected with China, and you would have seen significant amounts of movement between China and Africa, and indeed other parts of the world. I think these are the places where there is most risk for the virus to take hold and then spread. So unfortunately there's no vaccines to prevent infection with this virus, and so the only thing that people can rely on is trying to avoid contact with people who potentially have been exposed to the virus. So that means people who've recently travelled to Wuhan, Hubei province, and possibly even China. And really to urge those people who've travelled to those places to be aware of their own health. If they start to develop symptoms which are like a cold or flu, or they feel generally unwell, to contact the NHS on the helpline, the 111 helpline, and for them to be aware of the fact that they could potentially be a risk to other people. And for the rest of us, we can only do very simple things, but very effective things. And these things are effective not only against a potential coronavirus, but in fact lots of other viruses that will be circulating. And that's to adopt very good personal hygiene. So that's doing things like washing your hands very carefully, very thoroughly, as often as you can. Maybe even in the case of coronavirus, carrying the alcohol hand washes or hand rubs. They seem to be effective against these sorts of viruses. But in general, it's good hygiene, and in particular, if people have got symptoms of a cold or flu, that they themselves practice good hygiene, that they sneeze or cough into a tissue and dispose of it, and then wash their hands. And that way we can have a big impact on circulation of these viruses in general. So the virus can get into the place where it replicates, and we think this novel coronavirus generally replicates deep in the lung. But to get into the lung, there are lots of potential routes for the virus to take. For example, the most common would be through breathing through the nose or the mouth. But if you just deposit a virus onto one of those surfaces, so if you touch your mouth with your finger, or you pick your nose, or indeed if you touch your eye, because your tears drain into your nose, that can be a route for the virus to get into your respiratory tract and then find its way down deep into your lungs. And once there, it would set up an infection. At the moment, the signs are that this outbreak is going to be incredibly difficult to control in China. I think the increases in cases that are being reported are really quite worrying. Also, the estimates of how many people might actually be infected in China is quite immense. So even fairly modest estimates of the infections is about 100,000 people who are infected. To actually control that outbreak by identifying those infected individuals and isolating them, and then identifying their contacts, so that you bring the outbreak under control using standard infection control measures, that's going to be incredibly challenging. And then when you add into that the fact that there's been lots of travel, not only across China but also to other parts of the world, it looks highly likely that this virus will appear in other parts of the world, as it is doing so at the moment. And the key question is whether or not that virus will then become established in those other parts of the world, and if it does, how easy it will be to contain it. In developed countries, I don't think there's an immediate threat, but certainly in lower or middle income countries, areas where there isn't the same sorts of levels of health infrastructure, then I think it will be incredibly challenging.